everyone, we are now going to go over the flow cytometry plots from a lymph node from a 70-year-old man who presents with lymphocytosis and diffuse lymphadenopathy. So let's start with CD45 versus site scatter. So we said that the source of the specimen is lymph node, and you expect the lymph node to be populated by mostly lymphocytes. So that's what we see here in the CD45 versus site scatter. A majority of our population is just lymphocytes. We don't see any granulocytes or monocytes, and the blast window is negative. So sometimes when they do a biopsy, especially when they do a core biopsy or a needle core biopsy, there is a chance of contamination with some peripheral blood during the process. So there is a possibility that sometimes you will see some cells in the granulocytes and monocyte gate, even in a lymph node specimen. Just to keep that in mind. Otherwise, this is a nice, clean lymph node specimen with plenty of lymphocytes. And these lymphocytes have low site scatter and bright CD45 expression. Now let's follow through these lymphocytes to see the B and T cell population and see how they are. So when we see that in the 10 versus 20 plot, our lymphocytes express CD20, it's a little dimmer, and you could kind of see as variability in the expression of the CD20. Usually the normal CD20 expression in lymphocytes, it's a little brighter than this. This is a little dim. And these are negative for CD10, they're negative for CD34, they're negative for CD71. And when we see kappa and lambda, we see that all the lymphocytes are kappa restricted and they express a dimmer surface light chain. So when you evaluate B cells, that's what you mainly want to see. So if the B cells are polyclonal, that is, they show a good a good mixture of kappa and lambda population, then you probably don't have anything to worry about. It could be reactive, but if it is restricted, that's when you are going to say that it is neoplastic, because neoplasm is a clonal process, right? So a neoplastic cell proliferates and expands its own clone. So these are monoclonal. We cannot say that something is monoclonal by flow cytometry. We can say it is monotypic, but monoclonal cells are also monotypic, and they are usually restricted to one surface light chain. So here, this is kappa light chain restricted. So we can say that these are neoplastic. And again, here, this is a nice plot showing kappa and lambda on the B cells, and we see that these are kappa restricted, and also normal B cells would express bright light chains, but here the light chain expression is dimmer. And again, these cells are negative for 10 and 34. These cells are CD19 positive. They're negative for CD103. 103 is a marker that we use for evaluating hairy cell leukemias. So most labs usually have markers that are spread across the spectrum of B-cell lymphomas, so that you can isolate the population and add on more tubes if necessary. For example, we have CD10 to see if it is a CD10 positive lymphoma. They will have CD5 to see if it is a 5 positive lymphoma. We will see that in the next tube. And they'll have couple of markers to see if it is hairy cell leukemia. So here we have CD103 for that. So it is negative, so hairy cell is excluded. And now we have CD38 and CD19. So CD38 is partial in this population. CD38 is a prognostic marker in some lymphomas, especially CLL. So it is important to document the positivity of CD38, its intensity, and also the percentage of lymphocytes that express CD38. So here it is 53% of lymphocytes expressing CD38. So we have to mention that in the report. Now coming to tube 2, in tube 2, the CD19 positive cells are painted in maroon, and the ones that are negative are blue. So probably those are the background B cells and background T cells and NK cells. And our CD19 positive B cells are negative for FMC7. They're positive for CD200. They are all positive for CD5, and they have partial expression of CD23. And again, in this tube, it shows that it is kappa restricted. And this is, they have just gated the CD5 positive B cells, which is almost everything in this specimen. And they are again showing that these are kappa restricted. So the phenotype that we get from this plot is that these are Most of the cells in the specimen are lymphocytes as expected, and most of the lymphocytes are B cells, and the B cells express dim CD20 and are light chain restricted with dim kappa. They are all CD5 positive. So when it is CD5 positive, your main differential diagnosis would be the CD5 positive lymphomas, CLL, SLL, that is chronic lymphocytic leukemia, small lymphocytic lymphoma, or mantle cell lymphoma. And there are a couple of markers that can differentiate it by flow, CD23 and CD200. CD200 and CD23 are positive in CLL and they are negative in mantle cell lymphoma. There are other markers like, for example, CD20. CD20 is dim in CLL and CD20 is usually bright in mantle cell. And FMC7 expression usually goes along with CD20. If CD20 is bright, you often see a positivity in the FMC7. Therefore, CLL is usually negative for FMC7 and mantle is usually positive for FMC7. And also surface light chains are dim in CLL and they're bright in mantle cell lymphoma. So these are the factors that can help you differentiate between CLL and mantle. So whatever I described now applies for the classic CLL and classic mantle. So there are some cases of atypical CLL. So atypical CLL can, there are cases that can be 5 negative, they can be 200 negative, they can be CD23 negative. Sometimes they even express bright 20 and bright kappa. Not all of them would be seen in the same case, but you can see 1 or 2 of these variation in the marker expression in some cases. So the main thing that you have to remember is to see if it is light chain restricted. If it is light chain restricted, is it positive for 5 or 10? So here it is positive for 5. If it is 5 positive, is it positive for 223? So here it is positive for 223. So we can call this as a CLL SLL. So when we say that in our final report, because this is classic, we can call it directly as CLL SLL, and we can give the percentage of clonal, monotypic lymphocytes in the specimen, and we will also describe the phenotype, and we will give the percentage of CD38 positive neoplastic B cells in the specimen. Thank you.